Nancy Schoener, and I'm a deacon at Emanuel Lutheran Church in Pleasantville. And my ministry there is a health ministry. I also work at Calvary Hospital, so a lot of my time is spent here. And because I've done clinical pastoral education here, I'm able to bring my ministry here to work, which is very special. I try to bring my ministry from Emanuel and from what I've learned there as a deacon to work. And that's why I really was very happy to be a part of the clinical pastoral education program, because it did help me to learn better how to take care of people, not just physically, but in mind, body, and spirit. So what I do here is I'm a director of infection control and employee health here at the hospital, and I'm one of the directors in the nursing department. What's special is that I can also pray with people. So after I, do what I need to do, or before or after, I can mix both. I could blend both of those ministries. So my healthcare ministry that I do is part of what I do here at the hospital. When I see patients here, I may be doing anything for them physically, but then I can also connect with them on a spiritual level, and we do that a lot. So it's really a blessing to me to be able to do that here, because it helps me as a person, and it helps me in my spiritual growth. I see all of the patients when they come in, because we have to evaluate everybody for COVID. And so we do that by doing a nasopharyngeal swab, and I usually do those things. But what's special is that I can connect with patients when they arrive. It's such a difficult time here for staff members and for patients, because we don't have any visitors. And where I work, we usually have 24-hour visiting. Right now, we can't have people visit unless the patient is imminently dying. The other evening, after I had, physically done what I needed to do for the patient, then we started chatting, and he was talking about God and a higher power and how this is out of our control. And he actually does not have COVID. He was here because he has lung cancer. So he's in stage 4 with his lung cancer, and he knows he's dying. But we had a beautiful conversation where he was bringing, God into the conversation. And so we talked a little bit about his faith background and my faith background. And it was really a wonderful conversation. And so at the end, I just said, before I leave, can I pray with you? And he said, sure. So I took his hands, and I was able to pray for him. And just as I was finishing my prayer for him, he just chimed in and said a prayer for me. And when I asked him his name, he also asked me my name again. And so I had a personal prayer for him, but he in turn had a personal prayer for me. And I can't even explain what a wonderful feeling that was, because he really did make it personal for me. And I felt, again, with all we try to do for the patients, it's really amazing how much they give back and how much we get back from the patients in return. We have had a lot of COVID patients here. Yeah. We get patients here because we usually do palliative type care here, so we don't have vents. We don't have people on respirators. So patients from other hospitals who have been on vents would then get transferred over here. So we have two COVID units, one where we had 50 patients on that unit, and another smaller unit where we had 7 patients. So I've been in, both of those areas throughout this time. When patients come in, I try to make rounds and see where I could be of help. And the staff is also needy. They've been taking care of these patients, and we've lost one staff member to COVID, and 2 other staff members have died during this time. We've also had a couple of staff members, 2 staff members lost their husbands from COVID. Very difficult. We just had a memorial service last week for them, which was very nice to do. So it's been a tough time, not just, for patients, for staff, for families, It's been a tough time. So everybody had a lot to learn, and it was just amazing to see how people came together here to do what we can, for the families and for each other. It's been a tough journey, but a beautiful one in some ways. There's always some good to find. God always sends, where a door closes, a window opens, right? So it's beautiful.